a virus invisible to the naked eye, once caused hundreds of thousands of child deaths every year through one dangerous complication: severe dehydration. Rotavirus is a double-stranded RNA virus belonging to the Rotavirus family. It primarily infects infants and young children, targeting cells lining the small intestine. This infection triggers a cascade of fluid loss. Rotavirus spreads mainly through the fecal-oral route, often through contaminated hands, surfaces, food, or water. The virus is highly contagious and can survive on surfaces for extended periods. This makes it particularly dangerous in shared environments like nurseries. After entering the digestive tract, rotavirus infects mature enterocytes, lining the small intestine. Viral replication damages intestinal villi, reducing their ability to absorb water and nutrients. This results in a rapid loss of fluids and electrolytes. The body's natural balance is severely disrupted. Common symptoms include severe watery diarrhea and vomiting. Fever and abdominal pain are also frequent indicators. In young children, rapid fluid loss can quickly lead to dangerous dehydration. Recognizing these signs early is critical for survival. Time is of the essence when these symptoms appear. Severe dehydration can reduce blood pressure, impair organ function, and become life-threatening. If treatment is delayed, the physiological impact is profound. Without intervention, the body eventually enters shock. This is why rotavirus was once a leading global killer. Treatment mainly focuses on fluid replacement, using oral rehydration therapy or intravenous fluids in severe cases. Antibiotics are ineffective because rotavirus is a viral infection. Providing the right balance of salts and water is the gold standard. Rotavirus vaccines have dramatically reduced hospitalizations and deaths worldwide. It is a triumph of public health. Vaccination during infancy remains the most effective preventive strategy. The vaccine prepares the immune system for real-world exposure. It provides a shield for the world's most vulnerable. Simple, safe, and incredibly effective. Before widespread vaccination, rotavirus caused hundreds of thousands of deaths, especially in regions with limited healthcare access. International efforts have helped bridge the gap in care. Global health initiatives continue to prioritize child survival. The goal is a world where no child dies from dehydration. Rotavirus demonstrates how a microscopic intestinal virus can become life-threatening through dehydration, but it also shows how vaccination and simple rehydration therapy can save millions of lives. Science and care, working together for a healthier future.